Thanks for tuning in again to Med School Radio. Today we are listening to a Pediatrics Neonatology lecture, which will be helpful for those of you who are preparing for your shelf exam.
Yes, of course. Next, the baby is full term. Is born vagina NSVD. Upon stimulation, baby is vigorous, blah blah blah. But then when he's brought to the nursery, he's quiet, turns apneic and cyanotic again. What do you think is going on? We talked about this before. D, bilateral choanal atresia. You agree? So when the baby is pink, he's crying. When the baby is crying, the baby is pink, correct? Right. When the baby is at rest, he's blue. That's your classical case of bilateral choanal atresia. So you put the smallest NG tube in, you do a choanogram. You may have to create an airway, incubate the patient. Okay? Okay, next. What is the most common chromosomal pattern in an infant with ambiguous genitalia and normal internal female organs? So you're talking about virilization only. Okay, what is the best karyotype among these 5 or 4?
With normal internal female organs and ambiguous genitalia?
Yes.
And they just be A?
46XX, correct? Everybody agree? Okay, good. So that's why, aside from sending karyotype, the information that will give you quite a bit of information, do a pelvic ultrasound. Okay. Now, we were talking about hereditary spherocytosis. The babies confirmed. You do the osmotic fragility test, and maybe what is the new test now? Spectrin or something like that? You have a new test, Okay, so what is the recurrence risk for future pregnancies? A, because it's autosomal dominant, it's not recessive.
Hereditary spherocytosis, I thought was autosomal.
It's autosomal dominant.
Oh, then it's 50%.
So how many percent? It's autosomal dominant.
Shouldn't it be 60%?
It's the answer is there. 50. Did you whisper 50, right?
Yeah.
Okay. Sorry, I thought I heard you. 50%, Because it's autosomal dominant. Recessive is 25%, all right? Something like that. But of course, you have to add. And there's a formula. If the one sibling or one father or mother has it, it changes the equation. I think I forget the name of the equation. Okay, which cause Aldrich syndrome is characterized except okay, what's your answer?
Is it
It's X-linked. It's X-linked. That's correct. X-linked is correct. Except, this is except. I know they say no more except for your test, but this is not a test. This is just to like a review, like a study, Because there are topics I cannot cover in the lecture, so we do it like this. E, yes, increased risk of malignancy, right? The rest I copied from the book. It's X-linked transmission. It has thrombocytopenia. It's eczema. It has increased IgA, IgE, and decreased IgM. Okay. Now, which of the following components of cow's milk is most conspicuously different in quantity in breast milk? C?
I thought it was protein.
One of the protein.
Yeah, cows have higher protein,
Yes.
lower fat. Human milk has lower protein, higher fat.
Correct. But among the protein, there is one special protein that cow's milk doesn't have as much. That's why
Is it casein?
it's not the choice there.
Protein? I know, but the kind of
No,
Talking
it's
about
not.
the colostrum?
Not the colostrum. The answer is there. Taurine.
Oh.
Taurine. Yes. That's why you see some similar advanced, they will say, there's a term. Fortified with taurine. Okay, huh? Good for the eyes, good for the IQ.
So
That's what they say.
cow milk has taurine in it. Or are you saying human milk has
Breast
taurine
milk,
in it?
human milk has taurine. Cow's milk doesn't have it, but they have to make a formula very close to breast milk so people will buy it.
Right.
Yes. So they will put advertisement, fortified with taurine. Taurine, huh? Okay.
More like an energy drink than I
Well,
thought.
well, that's how they do it, huh?
Yeah.
Oh, the other day I went to Costco. Guess what people were buying? They don't sell masks though, but they were buying the other things.
Formula.
Not formula. But they were buying rice,
Oh,
Toilet
they're
paper.
they're stocking up
paper
for
towel.
the collapse.
Yeah.
Oh, like gloves.
Yeah. Gloves. If you go to Walmart and the mask, they selling them. Costco doesn't sell that, but you're buying that. What's that? Pellegrino or what? Pellegrino. You're buying that. Or you're buying the other Kirkland.
Yeah.
But you know they are. So this is herd mentality. I bought two.
So you're telling us that you're stocked up on rice and toilet paper now?
One bag of rice. Two. You know, Costco is very big, right?
Yes.
Yeah.
2 big toilet paper.
Oh, you got the
one-
25-pound bag of rice, is what you're saying? Yeah.
Yeah.
Stations only buy 50 pounds.
50 pounds. I think it was 50 pounds.
I thought, well, okay, what kind of rice? Because the basmati only comes in 25.
So it must be Jasmine.
Jasmine.
Jasmine. Okay. I forgot what I bought, but it's kind of heavy.
Yeah.
I am in.
Asian.
Right. So I mean,
Yes.
yeah. But I think I regretted I did it. But this is what we call herd mentality. They see everybody doing it. I said, what's going on?
You felt bad, but just in case.
Yes. So I did it too. Just so
And then you wait in line for 2 hours to check out.
not that long, 30 minutes. It's a long line, yeah. Because they have so many things.
Jeez.
Yeah, that's what can you do? There's such a thing. Is that the word herd mentality or
Yeah.
Oh yeah. Huh?
Mass hysteria.
Yeah. So I myself is a victim of that. Even though I was standing there just to get something and to eat the freebies.
Yep.
If they have freebies.
Oh, I go for the freebies.
Yeah, you know, they go there.
Yeah.
Then I saw everybody buying this, buying that. I said, oh, something's wrong. Then when I look, it's almost empty. Yeah. For a big warehouse. I said, I better buy myself.
Better buy something.
Yes.
Maybe they know something I don't.
Exactly. So just so you know, huh? So if you need toilet paper,
In your house?
you tell me, huh? Okay, huh? I ordered some, huh? All right. Okay. This one. An infant born to a diabetic mother looks ill. He has a big palpable mass on the right side of the abdomen. He is not urinating well and has evidence of ascites. KUB showed a bizarre patchy calcification on the same side as the mass. What's your diagnosis?
Nephrocalcinosis?
Let me see. Is it nephrocalcinosis? A big palpable mass, not urinating well, fever. Okay, because of the calcium, right?
It sounded good.
Okay, nephrocalcinosis. Okay. Although, when you say diabetic infant, there is a possibility for another answer. You have to do an ultrasound with Doppler. What would that answer be?
Ultrasound with Doppler.
Yes.
Renal vein thrombosis.
Yes, because an infant of diabetic mother are more prone to renal vein thrombosis because of relative polycythemia. Huh? So you could have either. So I think because I put calcification, it's more of nephrocalcinosis. Okay, all right. But don't be cognizant with the fact there's a renal vein thrombosis. All right, and that's one of the complications of polycythemia. Okay, glycogen storage type 1. What is the among these 5? What is the is A, glucose 6-phosphatase, right?
B and C are for alpha-1 antitrypsin deficiency.
Oh, okay, good. You remember your okay, and how about this lysosomal acylitis? Forgot what it was.
Isomal inclusion?
Huh?
It's type 4.
There must be,
Acid
huh?
maltase.
This is what? This is letter E is what?
Pyridyl diphosphoglucuronidase. transferase.
That's what for?
Liver.
Liver.
Jaundice.
This is the conjugating enzyme for
Jaundice.
physiologic jaundice. When you have relative deficiency of this, that's how your physiologic jaundice
Absence
starts.
if you do
If it's absence, is what? What syndrome is that?
It's due to Johnson's. Right?
No, Dobin-Janssen.
Complete what?
Follicular Najjar.
That's right. Follicular
Follicular
Najjar is the
Najjar.
worst one.
And then, or in the adult, what is that?
Gilbert.
Gilbert. Okay. Dobin-Janssen and Rotor are the
Absence, though?
the other thing, huh? Excretion.
Yeah, it's a
Secretion.
Yeah.
Now, all of the following are autosomal recessive and inheritance, except the answer is obvious. Which one is always a boy among these five?
Which one's always a boy?
Yes.
Is it
Not that one. Not A.
no, A is autosomal recessive.
Yes,
for
B
sure.
is autosomal recessive. So you're left with C, D, or E.
C.
C, it's how is it transmitted? Ornithine,
X-linked recessive.
X-linked recessive. That's why I say males, right? Okay, orotic acid, right? Okay.
Orotic acid.
Yeah. What is the difference between classical adrenal hyperplasia and 11 hydroxylase deficiency? Don't forget, clinic adrenal hyperplasia is 21 hydroxylase deficiency, right? Okay. So what's the difference?
So 11. Hypertension and urinization.
Hypertension.
Hypertension's in
Hypertension.
17.
Yes.
And
11.
No, hypertension is it's the 11, whereas the 21 has no hypertension.
Yeah.
Hypertension in the latter is the 11, right?
Yeah.
So that's the answer, huh? Okay, there's a baby who has hypoglycemia. Then you found a liver that's, hepatomegaly. And they have a papapos. So you have a hepatosplenomegaly, okay? Baby has hypotonia. Then you do an X-ray, you show cardiomegaly. So what's going on?
So he has hepatosplenomegaly.
And he has hypoglycemia. Keyword, hepatosplenomegaly, hypotonia, forefeeding, and hypoglycemia. And you have cardiomegaly.
He has
Pompe.
cardiomegaly.
Pompe, yes. Pompe, okay,
Yeah, Pompe messes with the pumps.
Yes. Okay, good. What is transient neonatal thyrotoxicosis? It results from placental transfer of what?
T3.
Not T3,
T4.
not T4,
P. TSH.
not TSH.
C.
C, yes. Remember, the longest choice is usually the correct answer. Oh, well, that's only my thyroid-stimulating immunoglobulin, huh? All right. Cefotaxime, you're very fond of using cefotaxime in the unit, right? It is not effective against which one?
It's ineffective against.
Among these five. Which one? E. coli, H. flu? So what do you think? Which one doesn't belong to the group?
So B.
B. Uroplasma is not, cefotaxime is not effective. It is effective against H. flu, E. coli, even group B strep, even though penicillin is the best choice, but you can use cephalosporin and Klebsiella. So what is the best antibiotic for uroplasma? Which, by the way, is the most common cause of chorioamnionitis. So what is the antibiotic of choice?
Yes.
It's the antibiotic of choice. You know this. Uroplasma.
Gosh.
Yes.
I'm trying to remember my sketch sheet.
Yeah. What's the antibiotic of choice for uroplasma?
Diet hint.
It starts with letter. It could be there are two drugs, but for this particular drug, it starts with letter E. Erythromycin. Macrolide or the azithromycin. Huh? Yeah. Huh? That's the drug of choice. Huh? And again, don't forget, it's the most common cause of chorioamnionitis. So if you see an OB who's giving ampicillin and for listeria, right, and cefotaxime and erythromycin, that OB is very smart because he's covering uroplasma too. All right? I don't know. You did OB already, right? Oh, of course, you are. This is last rotation. Did you see them, some OB? No?
Not with all three, treating the three.
Okay. Oh, okay. Because
so
you
they
can,
weren't as good, apparently.
okay, huh? But if the OB, because not in this place, I've rarely seen somebody putting erythromycin. But if they do, that's a very smart. Because you and I know that the cause of chorioamnionitis is uroplasma, correct? Most common cause. What is the most common sequel, not symptom, sequel of asymptomatic toxoplasmosis? Sequel, not symptom. That's a symptom. What are the, okay, let's talk about the triad of toxoplasmosis. What's the triad? You have diffuse, ring enhancing, intracranial calcification, right? It's a symptom. You have chorioretinitis.
Which is visual defect.
Yes, and you have hearing test for everybody, for all the throat infection. But the other thing is the triad is baby has hydrocephalus. This is the only throat infection that the toxoplasmosis has hydrocephalus. All of them are microcephalic. So normal head circumference is 33 to 35 centimeters, right? Okay, so what is the sequel? Sequel means complication, right? Could it be from the calcification, from the chorioretinitis, or from the hydrocephalus? Which is the most common? Not B.
E.
Not D. Not E.
Visual defect.
This was the thing you already said it earlier.
Yeah.
First choice is always correct.
I said it, but you said it was a symptom.
Oh, did I?
Yeah.
I'm sorry. I know I was talking to her about calcifications. I'm sorry, you were not talking at the same. So you said it. I was hearing her. You mentioned calcifications, right?
That was
No.
Oh, yeah. Okay. So that's why I said that was a symptom.
Yeah, I thought I was wrong.
No, I'm sorry. I was talking to her. So this was the effect from the chorioretinitis. Okay. All right. Because among all these, chorioretinitis has the most, so they could be blind. Okay, what is a full-term infant? He's now admitted to the NICU. His abdominal distended, right? Then you see perforated viscous with calcification again. Okay, what's the recurrence test? And what is this first? Today is a long one, so we can foresee the, forego the picture for next time. Huh?
So it's a perforated viscous.
Perforated viscous. Calcification. This is what? What is the recurrence risk?
Perforated viscous calcification.
I think for this particular entity, you may not have, but it can lead to something. That's what I'm saying. It's a letter B. Okay, my apologies. You have a perforated viscous with calcification. What is that first? Huh? That's? Pardon me?
I don't know on the full term.
Okay. First letter, M. M as in Mary.
Michael's diverticulum. I don't know.
No. Okay. I just whispered to you, huh? Meconium peritonitis. because of the calcification. Huh? Okay, meconium peritonitis, meconium ileus, meconium plaque, they're all the same family. When you see that delayed passage in meconium, it could be a sign of what disease? Cystic fibrosis. And how is cystic fibrosis transmitted? Yes, there are lots of mutation. So, which one? A, 25%, huh? I know it's a little, no, huh? The question was very vague, but okay. Now we're talking about the fistula. This is obvious. Think of the bacterial. V as in Victory, A, C, T, E, R, L. This is like a review. V, A, C, T, E, R, L. So what's the answer? E, imperforate anus, right? V is vertebra. A is imperforate anus or atresia of the anus. C is cardiac. T, E, the fistula. There are 5 types, right? The esophageal pouch, right? And then the distal fistula. R is renal. L is lymph, which is the radius most of the time. Okay, all of the following are associated with gastroschisis except
Is correct.
Except D. D. D as in dog?
Because there's,
Yeah.
there's no sac.
Yeah, okay, huh? Good, good. Okay, huh? Alright, so it is lateral to the right. There's no herniation lever. It's not like the omphalocele. And very few abnormalities, not like the omphalocele. You have so many, you have cardiac, you have what? And you have a normal umbilical cord, right? Because the omphalocele is on the umbilical cord, gastroschisis is to the right. Always to the right, huh? What is the association of the congenital disorder manifests as hyper increased bilirubin, fever, and chills? And you know this too. You come to the emergency room, 1 week of life.
So,
Yes, 1 week of life. Baby has jaundice, fever, and chills.
group B strep.
Not group is the think of something else. I give you a question very vague. Then you have to ask some more, huh?
E.
E. coli. Correct?
It's because the mom accidentally poops on the baby during birth, right?
Now, this is classical triad of E. coli. What is it? E. coli sepsis in the urine, galactosemia. So they have galactose 1 urinary phosphate, right? So they have cataracts, right? And they have high jaundice, most probably direct bilirubin. And they have fever because of the urosepsis. So when the baby comes to the ER, it looks jaundice, you do a direct bilirubin is high, check, don't forget to check the urine. For what? What are you, not for the white cell count, for what? What are you checking the urine for? Then you arrive at the diagnosis. Of course, you send the urine for culture, for white cell, but you do a urine test right then and there. Pardon me? No, not gravity.
Nitrate products?
Not nitrate.
Nitrate.
Pardon me? Not that one, huh? That's for the full analysis. Not that one.
Leukocyte esterase?
Pardon me?
Like the leukocyte esterase?
No, that's all for infection. Nitrites, leukocyte esterase, white cell is for infection.
So what are we looking for?
We're looking for something to diagnose galactosemia.
Oh,
Not ketone.
reducing sugar products.
Yes, that's the one.
Sorry, I thought we were asking about the
No,
E.
I'm
coli.
sorry, miss. I have to put them together, huh? This is a review, huh? We're looking at this, at the urine product. Aside from, I didn't mention, aside from the white cell count, the urine culture, what are we looking for? We're looking for the reducing substance, huh? The glucose, because that's your galactosemia. Because you have to give what? Change the formula to what? If the mother was breastfeeding, change the formula to what? Lactose free or soy, pro-soy or isomil, depends on your preference of that company, huh? All right. All right, next. What mode of therapy works best to decrease bilirubin production. Now, it could be something that's already used in Europe.
D as in 10.
Yes, D as in 10, huh? Okay, this is the one. Tin or zinc mesopropyrin, huh? They are using that in Europe and taking a long time. Now that they are busy with this coronavirus, I'm sure it'll take another year or two before they approve it, huh? All right? It's very good. In Europe, they give it, the staphylotherapy, within 6 hours, they take it off. It works like magic, okay? Okay, now you are talking about a 2-week-old. So this is a classical hip, right? Decreased abduction, positive ortholytic. So by the way, all breech, regardless of male or female, they have to have a hip exam, not right away, maybe 2 weeks or 4 weeks, huh? Okay? So this one, what would you do? You're thinking of a developmental dysplasia of the hip. D.
That's right.
Let me see. You only have a clinical diagnosis so far. So what's the next step?
Yeah.
Ultrasound. Ultrasound. No more radiography, huh? No more. Don't examine the baby in 2 months. My goodness. Baby cannot walk. What's
you
that?
see the dislocation with ultrasound?
Yes. That's the new way of looking at the ultrasound, the dislocation now, the developmental, huh? And public harness is the one that you pull the baby, huh? And this double diapers is passé, no more, huh? Even if you use triple diapers, no more, huh? It's an old wives' tale, huh? But our sister here, who already retired, she used to do that. Huh? Okay. What is the mode of inheritance in factor 8 deficiency? X-linked, right? Okay, huh? Obvious.
Hemophilia.
Okay. What about this? Cystic hygroma in the nuchal area? B, we talk about this. So, delayed separation of the umbilical cord involves the fake and what? Phagocytosis, right? Okay, huh?
Yeah.
Is that chronic granulomatous disease or not?
Yes.
Yeah, okay, good. Appropriate for gestational age is the one between 2.5 and 4 kilos, right? Now he has respiratory distress, what a term. Heart rate is 180, no hepatosplenomegaly. 2 hours, hemoglobin is 9. Indirect bilirubin is only 2 by reticulocyte. What test will confirm your diagnosis? So this is a chronic anemia so far, huh?
Yeah.
Okay, what test will? Yes, for a chronic anemia. You did OB already.
It wouldn't be B and C because we'd see a higher bilirubin, right?
Yes.
So
And osmotic fragility is for hereditary spherocytosis.
right.
Okay.
So we'd still have cell lysis.
Okay. So you have the retic count is normal for babies actually, right?
6% is normal for babies?
Yes, up to 7.
Okay.
Okay. The bilirubin is only 2.
I just do.
The heart rate is a little high, tachycardic, right?
Yeah.
So the baby is anemic, correct? Look, 9.
Yes,
9.
high output heart.
Yes, okay. So what test will you do to arrive at the diagnosis? So you're left with A, D, and E. Are you thinking of hemolytic disease?
No.
No, you're not, right?
Bilirubin will be higher.
Yeah, otherwise the bilirubin will be high, retic count will be high.
Yeah, so D and E would both be autoimmune, which would mean we'd still have hemolysis, so it'd have to be A.
A, not necessarily autoimmune, but it could be RH or AGO, right?
Right.
So, Clay-Howell-Beckett test on whom? On the baby or on the mother?
You want to do it on the baby.
On the mother.
Oh.
Yes, you do it on the mother within 24 hours. Okay? Clay-Howell-Beckett. What is the principle? It's an acid elution technique. Right? You see the ghost cells. Like Casper the Friendly Ghost, huh? Right. Then you count. It's an illusion. Just like for the RH, when you know how to how many vials do you give for the RH isomerization? The same principle. Okay? So the most number one cause of chronic anemia is your fetal-maternal hemorrhage. It's an antigen-antibody reaction. So there's some autoimmune component, you're right. Okay, circumcision. The PT is normal, but the PTT is high. So what do you think? Yes. Okay, straightforward, right? Okay. No need to elucidate, huh? Baby has cloudy cornea, and then after 3 days, still no change. I don't know why you wait for 3 days, right? So what will you do? How do you evaluate this? Among the 5. So this is a cloudy cornea is synonymous with what? Glaucoma. So what will you do?
Check the chocolate pressure.
Yes, that's a tonometer, huh? Okay. Now a 2-day-old, that's a full-term newborn infant, has pneumothorax, has a chest tube, evacuating the pneumothorax. 3rd day, the baby places a nasogastric tube and the respiratory distress deteriorate. A chest x-ray showed that the tip of the tube, the nasogastric tube, is in the right upper quadrant of the abdomen. What's going on?
B.
B?
B is the sinus nerves.
No, not that.
More than likely should have perforated.
Yes. So which one? A or E?
A.
Mm-hmm.
You said right upper quadrant.
Yes, right upper quadrant.
Yeah, then it would be
A.
Or sorry,
is
A.
esophageal.
Yeah, it's
A as in apple, right?
Yeah.
Esophageal, right? Because it's hard for you to have a spontaneous perforation of the stomach. You would have known it from day one, correct?
Yeah.
Because when you saw you did an X-ray for the pneumothorax, you would have seen that there's spontaneous. So be careful when you put an NG tube. Could have pharyngeal or esophageal perforation. All right, okay. Next, you have heart failure and evidence of myocarditis. Huh? E.
Dilated cardiomyopathy.
Yes, Coxsackie B, right?
Yeah.
How about Coxsackie A? What does it cause?
Hand, foot, and mouth
Hand, foot, and
disease.
mouth. So don't forget, huh? You see somebody with lesions, check for the hand and the foot, huh? Hand, foot, and mouth. All the following are salient clinical features with patent ductus arteriosus except. Is it active precordium? Yeah, it is hyperdynamic precordium, right? Is it tachycardia?
Yes.
Okay, let's skip that first. Is this diastolic hypertension? Except, right? Do they have systolic murmur? Do they have bounding pulses? Okay, active precordium, yes, right? They have hyperdynamic precordium. How about systolic murmur? You don't really appreciate the continuous maxillary like murmur. Systolic murmur is good enough. And then bounding pulses. The bounding pulses. Okay, we're left with B and C. They have white pulse pressure, correct?
Yes.
Yes. So which is which?
So if you have a wide pulse pressure, they're not going to have diastolic hypertension, right?
Yes.
So it has to be type. So it would have to be D.
Yes. So the answer is B or D or C? B.
B.
B as in boy, tachycardia.
Yeah.
Solid, except so they don't have tachycardia, right? Or they don't have diastolic hypertension.
Oh, sorry, they don't have diastolic.
Yeah, exactly. That's what you meant.
Yeah.
Huh? They don't have diastolic hypertension.
Right.
Okay,
Because
good.
of the wide pulse pressure.
Yes. Okay. All right. Last few. The newborn infant has scalp defect, coloboma, cleft palate, polydactyly, undescended testes, heart murmur. What is this?
It's trisomy. It's the missing scalp. It's 18.
13.
13 is
Tau.
missing scalp. Yeah,
Missing
the
scalp.
tau.
A tau, right? Because they have cleft palate, right?
Yeah.
It has polydactyly, right? Okay, so this is a trisomy 13, right? Okay. foramen of bodalic. Where's this bodalic foramen? Is it the left or the anterior foramen? This is the left foramen, right? In your anatomy, right? Okay. So what could happen? So this is your classical case of congenital diaphragmatic hernia, right? Excluding foramen of bodalic. So
A could happen.
it could happen. The contralateral side will be hypoplastic lung. Okay, how about B? You have vasoconstriction, you have abdominal musculature, right?
Right, so
Okay.
that's correct.
That will lead to letter C and D, correct?
Right. so
Pulmonary
probably
hypertension and for persistent fetal circulation. The baby remain on a shunting right to left, right? Because of the pulmonary vasoconstriction. So this is all is above is correct, right? Then you give what? You give 100% oxygen, you give nitric oxide, you give Viagra, right? Oh yeah, intravenous Viagra. Then you give inhaled prostaglandin. If all doesn't work, you send him to ECMO, all right? Or in between, you have to intubate, by the way, ventilate with a high pH, right? You want to create an artificial respiratory alkalosis. Okay, Hirschsprung's. What's the best answer? E. All of the above, right?
Yeah.
Yeah, you don't pass plutonium, you do diagnose with a viral enema. Remember the transitional zone with the rectal biopsy, right? And they are treated by excising, bypassing the ganglionic bowel and bringing the normal innervated bowel down to the anus. Okay, how many percent of Down syndrome will have Hirschsprung's disease? Or how many percent of, I think that's correct, right? How many percent, Hirschsprung's is also associated with Downs, right?
Yeah.
How many percent? Is it high or average or low?
I thought it was under 20.
Yes, under 20. What is the exact number?
8%.
Higher. Wow. Well, okay, good. Very good, huh? You can go for those, you're good in that, who wants to be a millionaire, right? Yeah. Because you can tell. Okay. What is the most common form of esophageal atresia? You know this too. In babies, not in adults. Because in adults it's the H type. See, that's why when I show you the X-ray, you see the stomach bubble, right? That is the fistula between the lower esophagus and the trachea. And they always have a blown upper part, okay? So C is the best answer, huh? All right. Okay, this one. Middle of the night, there is a 14-hour-old baby that's jaundice. Okay, mother is O, baby is A. But the Coombs test is negative. Does it mean anything? Don't forget that's an ABO setup, correct? Your ABO, even though the Coombs may be negative, correct? Because of the overwhelming antigen-antibody reaction. All right, next. So you have ABO, even though the Coombs test is negative. And now, the mother wants to breastfeed. All right. Facial jaundice means it's about 5, correct? Right?
Yeah.
Based on your visual assessment. So what would you do? B, rooming in.
Because you said that was the best way to decrease jaundice, right?
Right, okay, sure. Okay.
It's only 5%. Because it's only the face that's affected.
Correct. But, okay, so you will not order a bilirubin test and start in room, right? Phototherapy. This one, let's dissect this a little bit. Why is it more dangerous for this? Because of the ABO. Alright? Even at 5, or maybe 10, we don't know, facial, right? So I think you need, remember, what did we say? That visual assessment test is not accurate in a court of law. Correct?
I skipped over the ABO blood group.
Yeah. So you have to order
Yeah, we have stab bilirubin.
Yes. C, huh? You do a bilirubin test and go from there. You may not have to start in-room phototherapy. Depends on the bilirubin, of course, right? Okay, good. Because, why? Because the baby is 14 hours old, looks jaundice, and ABO. You have O and A, right? Even though the cum test is negative. And then to top it all, mom wants to breastfeed. And you have a breast milk jaundice too, right? Okay. Now, which of the following congenital anomalies is not found in association with esophageal atresia?
A, B, and C are.
Yes, bacterial, right? B, A is the interferon anus, the L is the lymph, C is the cardiac, so later E, right?
Yeah,
No
should
brain
be a brain
malformation.
malformation.
I think, is that the last one?
Sure.
Yes, last one. Okay. Okay. So it's almost 2:30. That's enough for today. Huh?
Yeah.
We spent 1.5 hours already. Huh? So I have a picture. We'll look at it week after next. Huh? I'm not
Yeah.
here next week, and then I'll send some more review. So what is your input? Is this okay? Is relevant? Huh?
Yeah.
Good for them. I mean, you took the exam already. So that Joseph can get 300.
Yep.
Joseph, huh?
Yeah.
You have to compete with the American graduates, right?
Yeah.
Don't forget you have to speak Spanish, huh? If you do pediatrics, huh?
Un poquito.
Un poquito, okay. Yeah, it will add. If you're a linguist, what else can you speak? Do you speak French?
No,
It's okay. There are not too many French patients.
just English.
English. So next time we'll do this, huh? Okay.
I could speak to the Hicks.
Okay. Okay. And then we will. Okay, huh? All right. Thank you for coming. So any questions for today?
When's the next lecture?
Week after next, most probably that Monday.
Thank you.
Monday and Thursday, I think.
Tell
huh?
Jasleen
Okay,
when
thank
the
you.
next one is.
Thank you.
Yeah, okay. Huh?
And then
So
she'll
next
let
week
you
I'm
guys
not
know.
here, but most probably the 17th, I will be here that day. So we will do it, and then I think 17 and 19. No, wait. No, not 19, 17 and 20. But I'll send an email to Joseph, huh?
Yeah,
Okay?
I'll
So
take
Joseph,
care
huh?
of it, yeah.
So this is my sublimation again. 300, huh?
Yep.
Is there such a thing as 300?
300 is the highest for staff.
Highest score?
That's a perfect test.
Oh.
I don't think that's gonna happen, but I'd be stoked if it did.
Well, that's why I have to constantly remind you.
Yep.
Yeah, sublimation. Okay, huh? So
It's a good way to study with interaction.
yeah. We are practicing, and then so hopefully next time you do it quick, huh?
Thank you.
So okay, huh?
Thank you very
You
much.
too. Okay.
Yeah, thank
Okay.
you.
Okay, don't forget. Takil, Takl. Is that Rosetta Stone for both of you? Spanish, right? Because you're applying already. You have to put it there.